Introduction to eyelash extensions. Eyelash extensions have become increasingly popular, offering a significant enhancement to one's appearance. This technique involves meticulously attaching an extension to each individual natural eyelash hair, one at a time. When applied correctly, they should not come into contact with the skin. The extension remains on the natural lash until it sheds naturally, and if done properly, it should not cause any damage. This innovative beauty solution provides a full, long, black, and curled lash appearance, eliminating the need for mascara. The global eyelash extension market was valued at over $1.5 billion in 2022 and is projected to grow significantly. The application process explained. Eyelash extensions are a fascinating technique designed to lengthen and thicken natural lashes, providing a very realistic appearance. Each extension is painstakingly attached to an individual natural eyelash, ensuring a seamless blend. This meticulous hair-by-hair application is crucial for a natural look and comfortable wear. The process is often compared to microsurgery due to the extreme precision required. As each lash is isolated and an extension is bonded to it. This careful method ensures that the extensions move and shed with the natural lash cycle, preventing damage. The goal is to enhance the natural beauty of the eyes without causing discomfort or harm. Benefits and daily convenience. Eyelash extensions offer numerous advantages, making the eyes appear more dramatic and defined while maintaining a feminine aesthetic. They beautifully enhance the length, curl, and overall definition of the eyeline. This eliminates the daily need for mascara, saving significant time during morning routines. Many clients report feeling more energized and ready to face the day upon waking, as their lashes are already perfectly styled. This convenience is particularly appreciated during summer holidays or when opting for a minimal makeup look. Studies show that individuals who wear lash extensions save an average of 15 to 20 minutes on their daily makeup routine. Protecting your natural lashes. Proper administration by a professional is paramount to ensure eyelash extensions do not harm natural lashes. Natural lashes must be allowed to grow and shed regularly, facilitating optimal separation and individual placement of each extension. This prevents damage and promotes healthy lash cycles. A common mistake is stacking extensions, which involves applying multiple extensions to a single natural lash or clumping them together. This practice can severely damage natural lashes by yanking them out in clumps, weighting them down excessively, or causing irritation. Always ensure your technician is qualified and adheres to proper isolation techniques to safeguard your natural lash health. Professional standards and licensing. It is crucial that eyelash extensions are administered by a qualified practitioner who is licensed and possesses sufficient hands-on experience. While many states require lash technicians to be licensed cosmetologists or estheticians, with additional certification in eyelash extensions, regulations can vary significantly, with some states having no specific requirements. Before scheduling an appointment, always verify the esthetician's credentials, including their cosmetology or esthetician degree, and a certificate of completion from an on-site eyelash extension training program. Inquire about their client experience and review their portfolio on websites or social media. This due diligence helps ensure a safe and high-quality service, as improper application can lead to eye infections or permanent lash damage. Longevity and maintenance. While an original set of eyelash extensions can last up to 2 months, it is generally recommended to return for fills every 2 to 3 weeks. This schedule allows for the replacement of any extensions that may have lost their form or shed with your natural lashes. The actual longevity of your extensions is heavily influenced by your adherence to aftercare recommendations and your natural eyelash growth cycle. On average, humans shed 1 to 5 natural eyelashes per day, meaning a full set of lashes will naturally thin over a few weeks. Regular fills are essential to maintain the desired fullness and appearance. Neglecting fills can lead to a sparse look as some extensions remain while others fall out, creating an uneven lash line. Adhesive safety and application. Eyelash extension adhesive is designed to be absolutely painless and secure when used correctly. Professional services utilize formaldehyde-free, medical-grade glue, which significantly reduces the risk of irritation or allergic reactions. The primary component in most lash adhesives is cyanoacrylate, a fast bonding agent also used in medical applications. Crucially, correct application ensures that the glue and extensions only ever make contact with your natural lash hairs, never the skin. This precise placement prevents any direct skin irritation or allergic responses. Always confirm with your esthetician that they use high-quality medical-grade adhesives to ensure client safety and comfort. Tate. Preparation for the procedure. To ensure optimal adhesion and longevity of your eyelash extensions, it is essential to arrive at your appointment without any eye makeup. The natural lash base must be completely clean and free of oils, makeup, and debris for the adhesive to bond effectively. Any residue can create a barrier, compromising the bond. Additionally, if you wear contact lenses, it's highly recommended to remove them prior to the procedure. This prevents potential dryness or irritation during the application process. A clean canvas is the foundation for a successful and long-lasting set of eyelash extensions, ensuring both client comfort and superior results. Contraindications for extensions. While eyelash extensions are suitable for many, certain conditions make an individual an unsuitable candidate. You should avoid extensions if you constantly rub your eyes, have extremely sensitive skin, or suffer from severe allergies. These habits or conditions can lead to premature shedding, irritation, or allergic reactions. Furthermore, individuals with watery eyes, severely curled or delicate natural lashes, or those with no natural lashes at all, are generally not good candidates. For example, severely curled lashes may not provide a stable base for extensions, and watery eyes can compromise the adhesive bond. Always consult with a professional to assess your suitability. Post-application care, first 24 hours. The first 24 to 48 hours after eyelash extension application are critical for the adhesive to fully cure and bond. During this period, it is imperative to keep your eyelashes completely dry. Exposure to water, humidity, strong breezes, or even light touching can weaken the adhesive bond, leading to premature shedding and reduced longevity. Avoid using any aftercare products, including lash extension sealers, during this initial curing phase. Refrain from rubbing or brushing your lashes and be mindful of environmental factors like wind. Think of the adhesive like paint. It needs time to fully dry and harden to achieve its strongest, most durable state. Mascara and colored extensions. Using mascara with eyelash extensions is generally discouraged, especially oil-based formulas, as they can hasten the decomposition of the adhesive. Waterproof mascara is particularly problematic, as it clumps the extensions and is extremely difficult to remove without damaging the bond. If mascara is desired, only use extension-safe formulas on the tips of the extensions. For those seeking a more natural or unique look, colored eyelash extensions are an excellent option. Brown extensions can offer a softer, more natural appearance than traditional black, complementing lighter complexions and hair colors. Vibrant colors like green can beautifully enhance hazel eyes, while purple can intensify brown eyes and make green eyes pop, offering a personalized aesthetic. Safe removal of extensions. Due to the natural development cycle of eyelashes, it is best to have eyelash extensions professionally removed after 3 to 4 weeks. Beyond this period, some extensions will have naturally fallen out, while others will have grown out with your natural lashes, creating an uneven and potentially damaged appearance. Attempting to remove extensions at home can lead to significant damage to your natural lashes. It is strongly advised to avoid pulling, rubbing, or plucking out extensions yourself, as this can rip out your natural lashes. Instead, schedule a visit with your lash artist. who will use a professional eyelash extension glue remover. This specialized remover safely dissolves the adhesive, allowing the extensions to slide off without causing harm to your natural lash line. Professional removal ensures the health and integrity of your natural lashes. Anatomy of the eye. Exterior components. The eye is one of the most vital organs in the human body, enabling clear vision that significantly enhances our daily lives and experiences. Humans possess binocular vision, allowing the brain to integrate images from both eyes for a comprehensive visual interpretation. This intricate system is remarkably well designed for depth perception and spatial awareness. The exterior components of the eye include the sclera, the visible white part made of dense connective tissue that protects internal organs. The conjunctiva, a stratified squamous epithelium bordering the sclera, produces mucus and tears for lubrication and moisture. The transparent cornea, located at the front, houses the iris and pupil and primarily refracts light. The iris, the colored part, adjusts the pupil's size in response to light, while the pupil is the minuscule aperture that focuses light onto the retina. Anatomy of the eye. Interior components. Beyond the exterior, the eye contains several crucial internal components. The lens, a translucent biconvex structure, is connected to the ciliary body by ligaments and works with the cornea to bend and focus light onto the retina. The retina, the deepest layer, acts like a camera film, containing 3 layers of neural cells, ganglion, bipolar, and photoreceptor cells, that convert light into electrical nerve impulses. These impulses are then transmitted to the brain via the optic nerve, a structure located behind the eyes, enabling visual perception and interpretation. The aqueous humor, a liquid between the cornea and lens, nourishes the eye and maintains its shape. Similarly, the vitreous humor, a transparent, jelly-like material between the lens and retina, primarily composed of water, proteins, and cellulose, helps keep the eye safe and spherical. These components work in harmony to facilitate sight. Common eye diseases. Numerous unique eye conditions and illnesses can affect vision, with refractive errors, cataracts, and glaucoma being the 3 main conditions that significantly degrade vision and lead to avoidable blindness. Globally, these conditions represent a major public health challenge, affecting millions of people. Historically, cataracts were the leading cause of blindness, accounting for a staggering 66.2% of all blindness instances, and 80.7% of severe visual impairment cases. While modern medicine has made strides in treating cataracts, they remain a significant concern, especially in developing regions where access to surgical interventions may be limited. Causes of eye issues. Eye problems can stem from a variety of factors, including heredity, smoking, infections, allergies, and exposure to chemical irritants. Nutritional deficiencies, particularly a lack of essential vitamins, also play a significant role in compromising eye health. For instance, prolonged exposure to blue light from digital screens can contribute to eye strain and potentially accelerate certain age-related eye conditions. Cataracts specifically are often linked to age, hereditary factors, and prolonged exposure to UV rays. Deficiencies in vitamins E, C, and B, along with insufficient protein intake, are also believed to contribute to their development. Understanding these causes is crucial for prevention and maintaining long-term ocular health, highlighting the importance of a balanced diet and protective eyewear. Glaucoma and xerophthalmia. Glaucoma is a serious eye condition often caused by an increase in intraocular pressure, IOP, resulting from either excessive aqueous humor production or impaired fluid drainage from the eye. This elevated pressure can lead to permanent nerve damage and vision loss over time. Early detection and treatment, such as eye drops or surgery to reduce IOP, are vital to preserve vision. Xerophthalmia, on the other hand, is the most frequent cause of childhood blindness globally, primarily rooted in vitamin A deficiency. This condition manifests as severe dry eyes and can progress to corneal damage and irreversible blindness if left untreated. Public health initiatives focusing on vitamin A supplementation and dietary enrichment have proven highly effective in preventing xerophthalmia in vulnerable populations. Eye symptoms: depth perception and glare. Impaired depth perception refers to the diminished capacity to accurately judge the relative positions of objects in space. Individuals with this issue may struggle to determine which of two objects is closer, impacting daily tasks like driving or pouring liquids. The brain creates the illusion of three dimensions, stereopsis, by integrating the two-dimensional images received from each eye. Stereopsis is most effective at close range, typically within arm's length. Beyond this, monocular cues like the apparent size of objects become more important for judging relative position. Another common symptom is experiencing glare, starbursts, or halos around bright lights, particularly when driving at night. This is often prevalent in elderly individuals, those who have undergone refractive surgery, or people with certain types of cataracts, where light entering the periphery of a dilated pupil is bent differently. Eye symptoms: night and color blindness. Night blindness, also known as nyctalopia, is a condition characterized by difficulty seeing in low light conditions and is commonly experienced by older individuals. While cataracts are the most prevalent cause, other forms of retinal degeneration, such as retinitis pigmentosa, can also contribute. Some older people experience delayed pupil dilation, making it harder for their eyes to adapt to dim environments. Color blindness, or dyschromatopsia, affects how some colors are perceived compared to normal color vision. The most common form is red-green color blindness, where individuals struggle to differentiate between dark or pastel shades of green and red. Despite this, colorblind individuals can often navigate traffic lights by relying on the position of the lights rather than their color, demonstrating adaptive visual strategies. Protecting your vision. Protecting your vision is paramount, and regular visits to an eye doctor are essential, even if you don't notice any changes. Many eye disorders develop without warning signs, making routine checkups critical for early detection. Understanding your personal risk factors, such as age, ethnicity, family history of eye disease, diabetes, or high blood pressure, can guide preventive measures. Adopting a wholesome lifestyle significantly reduces the risk of eye ailments. This includes maintaining a healthy weight, consuming nutritious foods rich in eye-supporting vitamins, exercising regularly for at least 30 minutes most days, and quitting smoking. Additionally, always wear sunglasses to shield your eyes from harmful UVA and UVB rays, even on cloudy days, and use proper protective eyewear during sports or hazardous tasks. For digital screen users, follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds to reduce eye strain.